Hello everyone. So now we'll be discussing cleft lip and palate. So this topic is a common topic for general surgery also and oral and maxillofacial surgery. You will again read the same topic in periodontics also. And in your oral medicine, like oral cavity problems, you will be reading there also. So multiple places you are going to read this topic. So this is very important topic, and every year 1 or 2 MCQs are coming from this cleft lip and palate. So you should know the basics of it, how it happens, surgery point of view, what are the treatment protocols. Like means first is you should know the etiology, the embryogenesis, why it forms, and then you should know the treatment protocols that may the moment the baby is born with the cleft lip and palate, on each day, each month, each year, what all treatments you need to do. So it is a multi-surgery, multidisciplinary approach is there. Right from the baby is born till 20 to 25 years, you need to take care, and multiple surgeries will be performed at different stages. And then cleft lip repair, cleft palate repair, you should know. Your Millard's rule, you should know. Rule of 10, that you should be knowing it. And there are so many other MCQs on this. So coming to the basics of cleft lip and palate. So some high yielding facts. Cleft lip is also known as culosis. This is the other name. And cleft palate is also known as palatoscasis. So this is the other name. So in every 800 birth, one baby will be born with cleft lip or palate. So in every 800 babies, one will be born with that. So that is a very high ratio actually. And compared to males and females, cleft lip is more common in males. So this is an MCQ. They can give you a question. Cleft lip is more common in male, female, both, none, all are equal. Cleft lip is more common in males, and isolated cleft palate is more common in females. So again, this can be made into an MCQ. 4 options can be generated over there. And this cleft developed during the embryogenesis stage. So that is 6th to 10th week of intrauterine life. Something goes wrong here at this moment, and because of this, in 6th to 10th week of intrauterine life, in the embryogenesis, something goes wrong, defects, we will be studying the genes and all, because of which the problem arises. So these are some high yielding facts which you should be knowing. Okay, and some other high yielding facts are the cleft lips are more common in the left hand side than on the right hand side. So now this is my left hand and this is my right hand. So cleft lips are more common in the left hand side, So if you are looking from the opposite side, it will be other one, because we both are sitting opposite to each other. So cleft lips are more common on the left hand side than right hand side. Again, an MCQ can be made on this. So why does this happen? Cleft lip and palate, why does it come? It comes because of lack of mesodermal proliferation along the lines of fusion of embryonic process. So you have got the mandibular process, the maxillary process, lateral nasal process, median nasal process, frontonasal process. So all this process fusion, some problem occurs. So lack of mesodermal proliferation along the lines of fusions of embryonic process, this leads to cleft lip and palate. And one more reason why cleft lip and palate is happening is because of increase in the maternal age, that is the mother's age. If couples are getting married late and they are having babies late after 40-45 years, then there are more chances of the baby getting cleft lip and palate. Okay, so these are all high yielding facts. Some more, the cleft lip repair is also known as chilorrhaphy. So this can also be made into an MCQ. 4 options can be generated there. So cleft lip repair is chilorrhaphy. Soft palate closure is called as stylorrhaphy. Palate repair is known as palatorrhaphy, and your hard palate closure is known as uranorrhaphy. So these are the 4 rhaphies, what you should know this: cleft lip, soft palate, palate repair and hard palate closure. So these are the basics of cleft lip and palate, what you should be knowing. So coming to an MCQ, Which of the following shows lowest frequency of cleft lip and palate? So this is just based on an article. So a study was conducted in different continents and then they came with this. So this is basically the inbuilt genes problem. If some areas are more and some areas are less. So the least, that is, that shows the lowest frequency of cleft lip and palate is in Negroes. So that is the answer based on the study conducted. It is directly taken from an article. So you need to learn this also. So this cleft lip and palate are associated with some syndromes also. So oral pathology you would have studied, so many syndromes are there. So this is associated with chromosomal problems, defects in the chromosome. So there is a defect with chromosome 13, trisomy 13, 18 and velocardiofacial syndrome. So along with these three chromosomal disorders, the cleft lip and palate is also associated. Not only chromosomal, even the Mendelian factors, non-Mendelian factors also are responsible, and Pierre-Robinson syndrome and Goldner syndrome, in these conditions also the cleft lip and palate is commonly seen. And then the Mendelian syndromes are Gorlin syndrome, Stickler syndrome, Teachers-Collins syndrome and van der Waals syndrome. So these are the Mendelian syndromes. And then some unknown reasons are Kabowski syndromes and some some teratogenic syndromes are fetal alcohol syndrome, fetal phenytoin syndrome and fetal valproate syndrome. So these are the few syndromes which is associated with cleft lip and palate. So almost like some 20-25 syndromes we have discussed. In these conditions, cleft lip and palate is a common feature in them. And this is because of chromosomal problem, Mendelian factor, non-Mendelian factor, unknown factor or teratogenic factors are there. Okay. So now whenever a baby is born with cleft lip and palate, you need to do some immediate things. So that is called as general management protocol for the cleft patients. Cleft means cleft lip and palate, both we are discussing together. So immediately when a baby is born, these are all MCQs. At what stage, what should be done? They can ask MCQ in either way. They can give an age 5 to 6 years what needs to be done, or they will tell a procedure secondary alveolar grafting is done at what age. So either way you should know this. So first and foremost, when the baby is born with cleft lip and palate, there is immediately after birth there should be consultation between the multidisciplinary approach. All the doctors should meet and discuss what is the problem, what is the extent of the problem, and feeding instruction, because the baby has to be fed. How to feed the baby? The lip seal is not there. So this all things, processes and has to be made. So this, all those things, a plate, RPD plate has to be made. So these things should be consulted. So consultation, feeding instruction and evaluation by geneticist has to happen. So who will check everything and know what is the problem, why it happened, what is the extent of the problem. Then within first few weeks of the life, you have to test whether the child, the baby is having any other problems or not. Like hearing testing also you will check. Hearing testing is there or not, you will check. Then 10 to 12 weeks when the baby, that is 10 weeks means almost like 3.5 months, right? 3 months, 3 to 4, or you can call it, okay? Or you can call it 2.5 to 3.5, you can call it like that way also. 10 to 12 weeks, you should do surgical repair of the lip. You would have studied Millard's rule of 10. So the 10 weeks have come here. So in the 10 weeks, surgical repair of the lip takes place. The first surgery is done when the baby is 10 weeks old. Hemoglobin should be 10, also should be there. Okay. And then before the age of 1 to 18 months, so 1 year to 1.5 years, surgical repair of cleft palate takes place. So first is cleft lip. Cleft lip at 10 to 12 weeks, 10 to 12 weeks, and then 1 to 1.5 year you will do cleft palate. First is lip, then is palate. And placement of pressure equalization tubes, you can do that. So now the baby is 18 months old, one cleft lip surgery is done and cleft palate surgery is done. Then 3 months after palate repair, so when we are doing palate repair, 18 months. So 3 months after that, that is when the baby is 21 months old, again you will check for speech and language assessment, whether the baby can pronounce words or not. because the lip seal is not there, the air will escape. So the sounds will not be pronounced in the correct manner. So you will be trying to assess that. That is 21 months. Then when the baby is 3 to 6 years old, then speech therapy has to be done. Treatment for the middle infection, if any infection is there, any fistulas, repair, soft palate lengthening, and psychological evaluation. Because 3 to 6 years they are like going to pre-primary schools and all. So aesthetic is a concern. So they may feel why I am little looking different from others. So psychologically it can impact the parents as well as the patient also, the child. So a counseling is required and psychological support is required. Then at the age of 5 to 6 years, pharyngeal surgery has to be performed. So all these things are MCQs, you need to learn perfectly at what age what needs to be done. Then at the 7 years, that means when the child will be in second standard, orthodontic treatment phase 1, we will start the ortho treatment first phase of the ortho treatment. Then 9 to 11 years pre-alveolar bone grafting. If there is a cleft palate, so the bone formation is not there. There is a discontinuity in the bone. So you will put some bone grafting materials over there. Then 12 years, second phase of orthodontic treatment starts. 12 years. 15 to 18 years, you can do implants and fixed bridges. Whichever teeth has not come, you can put implants and bridge and you can create the whole dentition. Then 16 to 18 years rhinoplasty. If this nasal septum is deviated, you can bring back to normal and you can do that. Rhinoplasty is 16 to 18 years. So they will ask at what age rhinoplasty is conducted. And then 18 to 21 years, you can go for orthognathic surgery, surgical advancement of the maxilla. You can do a Leafort 1 surgery and pull it forward. So that can be done at 18 to 21 years of age. So up to 21 years, by the time the child is born, till 21 years, you have to be on the constant vigil and the patient has to make sure the treatments are done at frequent intervals. Now for various techniques of unilateral cleft lip repair, unilateral, only one side cleft lip is there. So what all surgeries can be done or who all gave the concepts for the cleft lip and palate surgeries. So there are something called as Delay's philosophy, Millard's rotation flap. These are all surgeries. You don't have to go into details of surgery. The names are enough. Tennyson Radel lips repair and Rose Thompson lip repair. So these are unilateral cleft lip and palate surgeries. These are the names of the techniques what you need to learn. Again, you have got Miral's operations, modified Miral's and modified Z-plasty. This is very important. Modified Miral and Z-plasty. These are very important procedures what is carried out. And then you have again other surgery. So many were there, other names. Lee Mesurer operation, Nakajima repair, triangular flap repair and Jalaguer's procedures. And then again you have some more Hadron's operation, Collis procedure, Owen's operation, Cohen's operation. So in various parts of the world people were coming up with new technique. So you should just know Mirage is very important, what we discussed in the first few slides. Okay, so now the most common questions what they asked in MCQs is first is the general protocol, at what age what you should do. Either they will give the age and they will ask you what it is done, or what is done they will tell at what age you have to tell. That is one most common asked question. Second question is this what you are seeing, that is alveolar grafting. So the bone is deficient, you are putting grafting. So now you will see that two terms will come, primary alveolar grafting and secondary alveolar grafting. Primary, secondary. So please remember, any grafting which is done before the age of 2 years is called primary alveolar grafting, and any grafting which is done after the age of 2 years is called secondary alveolar grafting. So it's clear. So below age of 2 years, it is called as primary alveolar grafting. So at 0 to 2 years or any time before 2 years, if you're trying to put a bone over there, you're trying to create a bone, that is graft materials you are putting, so that is called as primary. After 2 years, I told this is secondary. So this secondary is again you are giving at various stages. So you have got secondary is again subclassified into early secondary, then secondary or late secondary. Three you can categorize. So secondary, early secondary is if it is 2 to 5 years, because below 2 years is primary alveolar grafting. 2 to 5 years is early secondary. 6 to 13 years is called secondary grafting, and bone grafting done after the age of 13 years is called as late alveolar grafting. So these are again so many MCQs can be generated from this concept. And grafting is also done at the time of Leaford 1 osteotomy, that is 18 to 21 years, and then revision grafting can be carried out at any point in life. So this alveolar grafting you should know very well at what age, what is it called as. So let us do an MCQ. This is cleft lip and palate is seen in. So we have discussed all the syndromes, some almost like 20 syndromes we have discussed. So Pierre Robinson syndrome, yes. Treacher's-Collins syndrome, yes. Apert syndrome, yes. So all of the above should be the answer. Yes, so this is in all of the above. So this is seen in cleft lip and palate is seen in Pierre Robinson syndrome, Treacher's-Collins syndrome and Apert syndrome. So this we have already discussed this. Next MCQ. The earliest operative procedure undertaken in the management of complete unilateral cleft lip, earliest, with alveolus and palate. So there is a alveolus defect and the palate. So cleft palate is there and the bone defect is also there. Grafting is also required. This and cleft palate surgery is also required. So earliest, the first surgery we do is cleft lip repair, and cleft lip repair is known as chilorrhaphy. So that's why you should know the names. So it should be chilorrhaphy. Yes. So the answer is chilorrhaphy. This is how it should be. So the explanation of this you will see in so many MCQ books. Again, the treatment protocols depending upon the age, what you will do, when hearing test, what time speech test. So this all things we have already discussed that. 16 to 18 years, the final nose and rhinoplasty and lip revisions will take place. So this is all we have already discussed. Coming to the next MCQ. The most important reason for placing an alveolar graft in cleft palate patient. So why are you placing a graft? What is the need of it? Why do you want to put a bone over their graft? To improve pronunciation. Pronunciation, you need a good lip seal, and well, yes, the bone also, but the lip seal is more important. Improve breathing efficiency, that can still not affect much. Make eruptive pathway for permanent canine. Improve feeding efficiency. Yes, so the aim, why do you put alveolar grafting? I'll tell you now. The main aim of alveolar grafting in cleft cases is to restore normal form and function of orofacial tissues. If the bone is proper, soft tissue will also develop accordingly, thereby allowing the child to develop to his or her full potential. So, if you give the bone, everything will follow it. So this will be make eruptive pathway for permanent canine eruption. So if alveolar grafting is done, then the canine can develop properly, and you know that canine is the cornerstone of the dental arch. So anterior teeth, posterior teeth, once you get the guideline, you can know, okay, from here everything front is anterior, from here everything behind is posterior teeth. So you will get a landmark. So canine is very important. With that landmarks, you can develop the occlusion at a later stage. So this is all about cleft lip and palate. So the questions what you should study is first the high yielding facts, second is the embryology part of it, like how it forms, and then you should know the treatment protocols, the time management, each age what it happens, and then Minard's rule of 10, and then your the why this alveolar grafting is done, what is primary alveolar grafting, what is secondary alveolar grafting, what age it is done, and the syndromes, in which all syndromes cleft lip and palate does occur, and then the name of the surgeries, that is enough. Some names of the surgeries for cleft lip and palate you should be knowing it. So that's all in the topic of cleft lip and palate. Thank you.